Up first, this evening, health officials will continue meeting with irate doctors next week to resolve payment and employment concerns causing uproar in some regions. The Jamaica Medical Doctors Association is outraged at short-term contracts being offered to over 140 doctors and delayed hazard payment for members working on COVID-19 wards. Details in this report. There's disquiet yet again among public health doctors. This time over delayed hazard and gratuity payments.
The hazard pay is months behind. I can't think of any single hospital that is less than 2 months paid up. The gratuity that we were promised that all gratuity owes would be paid June 2021 cycle, and of course, payday has come and gone. The gratuity is unpaid.
The president of the Medical Doctors Association was speaking on Beyond the Headlines on Friday. No hazard payment is due to doctors who are working on COVID wards. Another concern, over 143 doctors are uncertain of employment come July 1 as their contracts will expire. Dr. Fitzhenley is livid that some members are being offered 6-month contracts, a breach of their heads of agreement.
We will not be taking anything less than what it is that we have previously negotiated, which are 2 or 3 year contracts. That's the bottom line. It's honestly heartbreaking because it's like we were pushed to our limits, and we still continue to do it now. And now when we're asking to be treated fairly, just like any other union who also signed heads of agreement, our own is being breached continuously with no explanation for why. And that is why the JMDA has said, enough, we will not take this anymore.
Now the government is moving to allay these concerns. On Friday, Health Ministry officials met with doctors and the regional authorities. There's to be another meeting next week. Here's Health Minister Dr. Christopher Tufton.
As it relates to gratuity payments, we have to ensure that we do not have these outstanding payments because we need to keep our doctors motivated, and indeed if they work they should be paid, and I've made that very clear, and so that is one of the issues to be discussed. As it relates to short-term contracts, I'm a little concerned as to why one would give that short a contract, and again that's an issue that's going to be discussed today, and I intend to meet with the JMDA early next week to have a conversation with them, and if that is indeed the case, we have to find a way to fix it.
Dr. Tufton concedes the unease is justified, noting that better communication is needed.